Hello, everyone. You're welcome to today's class. We're continuing with our study, and today we're taking the part 3. This is a continuation of the main course titled Health Program Planning Evaluation. And we have taken the part 1, where we discussed the program implementation and management function. We also went further to discuss the principles of health program management, organizing, staffing, directing, controlling, and also we looked at leadership in in program delivery. We went further also in the part 2 to discuss support systems for health program implementation. And there we discussed about logistics, communication, supervision, health information system, and record keeping. Remember also that we talked about practical demonstration of data recording and reporting formats. In this particular lecture video, we will be talking about, as a continuation for the part 3, we'll be discussing monitoring of health programs. Monitoring of health programs. And we'll be looking at the indicators used for monitoring, what data is collected, how do we do the performance tracking, and how do we make our reports, what mechanisms. We'll also be designing a simple monitoring evaluation plan so that you have an idea as a public health student, as a professional, how to go about designing a simple M&E plan. You will see the importance of the M&E plan as we go on. Furthermore, my name is Dr. Amy Aisagbayi, and I'll be taking you through this course in the next few minutes. In detail, we'll be looking at indicators, like I said, data collection tools, the performance tracking, how it's done, and the mechanism. And then we're looking at how to design a simple monitoring and evaluation plan. So this is the topic overview, what and what we'll be looking at. So let's start with the definitions. Now, the first definition we'll be taking is monitoring. Monitoring is a continuous systematic process through which health programs collect, analyze, review, and then they use information to be able to track whether implementation is proceeding as planned or not. It provides a real-time insight into what is working, what is lacking behind, and what requires corrective action. So the key elements of monitoring include regular data collection. It also includes comparison of performance with set targets. It also includes identification of gaps, using findings to guide timely decision making. And monitoring is not an end of project activity. Monitoring begins on day one and will continue throughout a program's life cycle. So now you understand that monitoring, it's a continuous aspect of the lifetime of the project. And it's a systematic process through which, like you've heard, health programs have to collect, analyze, review, and then use information so that they can track whether implementation is proceeding as planned. And I've told you that it provides real-time insights so that we know what is working, what is lacking behind, and what requires corrective action. And it actually begins from day one throughout the lifetime of the program life cycle. Number 3 is the indicator. The indicator. Now, for the indicator, we are looking at the definition, which is a measurable variable that provides evidence on whether a program is achieving its objectives. An indicator is a measurable variable that provides evidence on whether a program is achieving its objective, whether the program is making progress. And indicators must be very clear. They must be quantifiable. We should be able to say, okay, this is the extent, or it is achieving the goals. We should be able to say to what extent the improvement, has been achieved, not just qualitatively, but quantitatively. And then it also ensures that you can link directly to the program goals. So with indicators, you can link it directly to say, okay, this is the particular goal that we're achieving right now. You can link it. You can be sure that you can, identify which ones we are making progress on. So indicators actually help managers to be able to answer the following questions. Are we on track? Are the activities being implemented? Are the outcomes being achieved? What corrective actions are needed? So these are very important, findings that indicators will help us, answer. So this takes us to the next definition: data collection tools. The data collection tools. The data collection tools, when you hear the word collection, it reminds you of the fact that information needs to be gathered or is being gathered. And this brings to mind that you need instruments to be able to gather such informations. So you can simply say that data collection tools are structured instruments that have been calibrated, instruments that have been prearranged for specific purposes. So they are structured instruments that are used for gathering information. They are not just any kind of tool. They have a specific purpose, designed for that purpose, and what needs to be collected has been, programmed into it so that it can be able to collect this information in a structured manner, in full compliance with the, calibration. In other words, whatever instrument will be used to collect data must have been designed for that purpose ab initio. So they range from facility registers to electronic systems such as district health information system, which we have discussed in part 2. They also ensure consistency, accuracy, and standardization of data entry. Examples include tally sheets. Remember, we discussed this in part 2. We also have integrated disease surveillance and response. We discussed this in part 2. The stock control card, supervision checklist. We also talked about the antenatal care registers. We discussed all this in chapter 2, just to recall, the mind to those important facts. The next one is the reporting mechanism. The reporting mechanism is the structured pathway through which data moves from the point of collection, usually the facility, to higher levels for aggregation, review, and feedback. I repeat, a reporting mechanism is a structured pathway through which data moves from the point of collection, usually the facility where it is collected, and then it is moved from the point of collection to where those informations are needed. And that is usually at the higher levels where they are aggregated together, they are reviewed, and feedback is provided. A standard flow in Nigeria is that you have from the facility where the information is produced to the local government area, where you have the M&E officer who then sends the information to the state, where you have the health management information system, and then sent to the national, where you have the district health information system to repository. So this is where all the information from the facility to the local government to the state is gathered at the level of the national. And we see that this mechanism ensures that there's a timely transmission, there is a complete, data collected, accuracy is not, out of place. All the information must be accurate, and then the constant sending and feedback will remain consistent. So this is very, very important. So that takes us now to, after you have sent information, there will be need to monitor and evaluate. So that takes us to monitoring and evaluation now. In the monitoring and evaluation plan, there is certain, how will I put it now? There are certain things that make up an M&E plan. First, the M&E plan is the guiding document that will outline the indicators. It will show you what their definitions are, what the data resources are, the reporting frequency should be, the responsibilities of each person, the data quality procedures, performance review mechanisms, and it ensures every actor understands what to measure, how to measure it, when to measure it, and by whom. So you see what should be found in the M&E plan. So it's a guiding document for monitoring activities. And in that document, it should have all this outline that I've stated. What are the indicators? The definition precisely of those indicators. Where will the data be sourced from? The reporting frequency, how frequently should these things be reported? The responsibilities, who does what and who does what? And then data quality procedures, and then performance review mechanisms. This will ensure that there is clarity on what to measure, how it should be measured, when it should be measured, and by whom, who is to do the measurement. We move to the next aspect, the key concepts when it comes to monitoring. There are many areas, but there are key concepts that we must always, dwell in. We must hold on to this key concept because they sort of summarize every other concept. So, what are those key concepts? They include tracking implementation efficiency, because that's the importance now of monitoring, which serve as the key concept. Number one, if you want to do monitoring, you want to engage or carry out monitoring, which supports program, you can only do that by ensuring that you engage proper tracking implementation efficiency. So monitoring supports programs by tracking them, the implementation efficiency, by identifying operational bottlenecks, supporting accountability, enhancing data-driven decision making, and improving service delivery. So these are the importance of monitoring. We move to the next aspect, where we want to identify the operational bottlenecks. The operational bottlenecks. Example of the bottlenecks, number one, you have health workers absenteeism. And so in trying to monitor, it could become difficult because you find out that health workers are absent. There is the delayed vaccine deliveries. There is also incomplete registers, and there's low community turnout. These are operational bottlenecks that affects, the process of monitoring. Now we see the types of program indicators. The types of program indicators, and we have just 5 major indicators categories. 5 major indicator categories. Number one, the input indicator categories, the process indicator categories, output indicator categories, outcome indicator categories, impact indicator categories, and together they provide a complete performance picture. Now, when we say input indicators, let's take them one by one. The input indicators, they measure the resources committed into a program. For example, the number of long-lasting insecticide nets that have been procured. So that's another resources that have been committed into a program. The funds disbursed for outreach. That's another, resources that has been committed into the program. The number of health workers that were trained. That's another resources that have been invested or committed into the program. So input the indicators, the measure resources committed to the program. The next one is the process indicators. The process indicators measure the activities carried out using the inputs. So when you have brought in the inputs, the process indicator will measure the activities that was carried out using the inputs. That's the resources that was brought in. For example, when you see process indicators measuring, we can use the examples such as the number of ANC clinics conducted. We have employed health workers. We have brought in facilities, infrastructures. So we want to see what is the number of antenatal clinics conducted. We want to see the number of supportive supervision visits done. How many supervision was done? How many visits, was paid to those sites? And then we want to see the number of outreach vaccination sessions. How many took place? Where and to who? So that data has to. So here you see the number of antenatal clinics conducted, the number of supportive supervision, the number of outreach vaccination sessions. If I take you back to the input indicators, remember that measures only the resources that was committed into the program. But when you come to the process indicators, it goes beyond measuring. It checks, the activities carried out using those resources that was provided. Now the resources is being put into use, and that's why we're looking at the number of outreach vaccination sessions, the support supervision visits that was done, because you were given a car. You were given resources to be able to mobilize supervision. So we want to see the number of supportive supervision you were able to do, and then we want to see the number of antenatal clinics that was conducted. Were all the patients seeing only one person, despite the fact that we have employed a lot of health workers? This needs to be checked. Now we have the output indicators. This measures the immediate direct results of program activities. It measures the immediate direct results of program activities. For example, percentage of pregnant women who receive intermittent preventive therapy. Again, the number of children that vaccinated during a session. Now, this is clearly measuring the immediate direct results of the program activities, because it is called output indicators, results, eventual impact. And so if you look at this example, the percentage of pregnant women that received the therapy, the number of children that received the vaccination during a particular section. Now we'll see beyond output indicators, we have the outcome indicators. The outcome indicators. This reflects both short to medium-term health improvements among targeted population. It reflects the short-term to the medium-term health improvement that have taken place among the particular target population. For example, the increase in ANC attendance rates, you see, in that locality, we want to see the outcome, following the successes, following the other indicators. We are now seeing the outcome indicators, which now specify that the ANC, the antenatal care attendance rate, has gone up. People are now coming to enjoy, to utilize the services provided by the government. Why? Because other indicators have shown tremendous improvement. And so people are beginning to talk about the wonderful things done in the health clinic. And that has encouraged even those who do not like to come. It has encouraged them to begin to think of utilizing the amenities, the resources provided in the health clinic. We also see the increased use of insecticide-treated nets by the pregnant women. Instead of using it to sieve gari, fufu, and other things, they now use it actually to prevent mosquito bites by sleeping under the mosquito net and treating it properly. We also see that there is a reduction in missed opportunities for immunization. So instead of them in the past bringing their children, they do not, for different reasons, rumors and so on. But following the confidence that has been, observed in the programs, following the success that the program has been able to impact, the people now bring out their children for immunization. They don't miss it anymore. They don't lie that their children have collected already or locked them at home. They bring them out so that they don't miss these opportunities for immunization. So these are very good outcome indicators that have shown that there's improvement among the targeted population. At this juncture, we want to now see impact indicators. So what is impact indicators? These reflect long term. Remember that the outcome indicators look at short to medium term improvements, but the impact indicator reflects on the long-term population level change, long-term population or long-term changes at the population level. So it's not just a short to medium, but a long time. For example, we see the reduction in maternal mortality ratio. Women don't die like it used to happen before. The rate of death of women during delivery has reduced. We have the decrease in malaria incidence. That has also improved. Now you've seen that the number of malaria incidents, people coming down with malaria disease, sicknesses, has gone down. Why? Because they now use the mosquito nets. They ensure that they have mosquito nets, doors, and so on at the windows, all in the bid to prevent the invasion of malaria. We also see the reduction in HIV transmission because unwholesome practices, they have been trained, they have been enlightened, and it is now one man, one woman, one partner. Also, they've gone to test themselves, and then they know their status. They also understand the very importance of using condoms and so on. So there's a strong reduction in HIV transmission as a result of the resultant impact, resultant outcome of the education, training, campaigns that have taken place in the past. So this is a strong impact indicator, a change which is a long term at the population level, and it's for good. Now let us see the theoretical frameworks. What are the theoretical frameworks? Remember, I told you that frameworks are like the foundation upon which projects are done. You don't just carry them out based on your own personal initiative or how you feel it should be done. No. These things are done based on specific frameworks, and these frameworks are known as models or generally known as frameworks that serve as the foundation for implementing those projects. So we'll take the first one, which is the logic model results chain, the logic model. If you check the WHO Oxford Global Health Public Health Chapter 11 and also WHO 2022 document, you will see a model there. It shows the cause-effect progression. So when there is an input, the input bring about activities that are carried out in line with the goals, in line using the resources that have been supplied, and then there is an output. Now, this output will lead to the outcome, which is a short term to medium term, and then you have the impact, which is a long term. So from input to activities, activities to output, output to outcome, and then you have the long-term impact. So this logic model will help managers define what indicators are needed, will help them link the resources to the results, and they'll be able to track implementation logically to know where we are, what we're doing, and if it is being done very well. Again, look at the Donabedian model, where it's about the structure put in place, the process where we utilize those structures, and then the outcome following the impact of the activities in the life of that community. So structure has to do with the infrastructure, the staff, the supplies that were made. The process is how the service delivery or the action in the course of the service delivery was, approached or put forth before the community. The outcome simply means the health results. You carried out a campaign on the issue of malaria infection, diarrhea, HIV, and so on. The people listened. They go back home and begin to carry out the advice, and that way, one by one, they begin to cut down on those negative, effects, and that way, their results, the health of this community begins to improve. And not just improving, you can find the indicators showing that it is truly improving, because the impact, the increase, the utilization of the facilities, of the products will go on the high side. It will increase, it will improve, and that will bring about good health results. So monitoring uses this model to be able to design their indicators. So that's that. We now look at the models used in monitoring. We'll start with the performance monitoring framework. The performance monitoring framework. Now, this framework, this is the structure. Indicator put in place, data source, the frequency at which the data is collected, the officer responsible for it, and the use of the data. That's the framework structure for performance monitoring framework. So example, when you say indicator, you say the percentage fully immunized children as an example. We want to say the percentage of fully immunized children. How do we get that data? We use registers or the district information system. We also have the frequency. What is the rate at which these data will be received monthly? And then look at who will be responsible in terms of payments, sponsoring, the LG, and the monitoring evaluation officer. And how will they use this, information? They will use it to identify underserved wards, those wards that have not really enjoyed the dividends of the government input, especially in health. They're able to identify that particular area, and that ward will receive benefit, maybe the building of a public health center or facilitation of their access to health clinics, no matter how far it may be from their ward. The next thing we'll be looking at is the data quality assessment model. Like I said, done by WHO 2010. The quality dimensions include, number one, accuracy, that the data must be reliable, The data must be complete, nothing is missing, and it must come timely. It must have integrity and must be consistent. So that is all that you need to know or have in front of your mind concerning the quality dimensions that is needed for the DQA model. Like I said, the data must be accurate, reliable, must be complete, timely, integrity-wise, and must be consistent. So a strong monitoring always includes the quality, the data quality assessment, because in monitoring, you need data to be able to cross-check what you have and what is available to ensure that there is a balance. So let's look at the detailed content areas. Let's look at the detailed content areas. One, we'll start with the SMART indicators. These indicators must be specific, like I've said, measurable, must be achievable, relevant, and time-bound. For example, in Nigerian immunization, we have the output, which states the proportion of outreach sessions conducted. That's the output, the proportion of outreach sessions that were conducted. Now, the outcome, the percentage of children that were fully immunized within the 12 months. So the output is the proportion of outreach sessions that were conducted. What's a proportion? Okay, now that they have conducted it, what is the outcome? Now we are talking about directly the percentage of children that were fully immunized within that 12 months. Next, we'll look at facility registers. These facility registers, they capture daily service data. For example, the ANC register, immunization register, the OPD, ordinary patient, outpatient department register, the HIV care card. All this ensures standardized documentation. Very, very important. They all ensure standardized documentation. They ensure standardized documentation. Very, very important. Now let's see additional data collection tools. Like we discussed in the part 1, we talked about tally sheets. We talked about the IDSR, which is weekly. We have talked about these other ones, which are monthly, the stock control cards, and the supervision checklist. So these are different additional data collection tools that are used. We also use in Nigeria specifically the DHIS2, which is Nigeria's official digital platform, and it is used for routine monthly health, reporting. You need to know that because it could be asked DHIS2. Now let's look at performance tracking. Performance tracking. This has to do with analyzing indicators, comparing results with targets, identifying underperforming areas as observed, and supervisory visits to those sites to see what is happening, and also the trend visualization. And so a good example is that of the Primary Health Center Development Agency, which uses reaching every ward strategy. And that is the real strategy. And so their goal is that every ward will be reached in order to be able to track the immunization performance in all the local government areas. So that's the adopted strategy, titled or tagged reaching every ward. Under that strategy, you will now see the details of how this will be achieved. Can it be achieved? Yes. How will it be achieved? This will be stated, and then the resources will be provided, and then we expect an output, and then we expect an impact. Now let's look at the reporting mechanisms. When you say reporting mechanism, simply means perhaps you can call it the routine reporting flow. And you find that chain from the facilities to the local government area monitoring evaluation officer, to the state health management information system unit, and then to the national district health information system too. Now, each level reviews, each level validates and aggregates the data. So what are the types of reporting? You have the monthly routine reporting, where you submit your report every month. You have the weekly disease surveillance reporting, where you do it on a weekly, basis. You have the quarterly review meetings. Now, what are the qualities of a good report? Good reporting. Number one, it should be timely. That means submitted before the deadline. It should complete all the fields that have been filled. It should ensure that the register is accurate so that it can match the information that are needed, that is with the register. So you must ensure that your reporting is accurate and it should match what is on the register, and it should be consistent. That is, it should be stable. The trends, should be stable unless explained. You make sure that they are stable. You make sure that they are okay, except unless explained. So that's about reporting mechanisms. So next, we are going to see how to design an M&E plan. And this is the height of it. I need you to really take time out to listen, because you must be able to design the monitoring and evaluation plan, having known the basics, what it entails. So we'll take an example and we'll learn with that. Now, when you say a sample program goal, that is, you want to design the M&E monitoring plan, you must understand, why do we do that? An example: to increase the ANC attendance in Oromo local government area from 60 to 80 within the next 12 months. From 60% to 80%, we want to increase. We want to see that the ANC increase attendance. So there should be an increased ANC attendance in Oromi local government, that is Oromo local government. And it's definite, from 60% to 80%. That's the goal. And the timely is there, 12 months. So here you can see the M&E plan for ANC attendance program. You can see M&E plan for ANC attendance program. You can see the objective: to increase ANC attendance from 60% to 80% within 12 months. And then you can see the indicator, the type, data source, frequency, responsible officers, use of data, and so on. So here we can see the number of ANC sessions conducted. Here we can see the percentage of women attending ANC at least once. We can see the percentage of women completing 4 ANC visits. Then you see the outcome, see the ANC register, quarterly or state. So you see that maternal mortality ratio is also part of them. So this is a kind of ANC attendance program. Now the question is, what indicators do we put that will help us check, that will help us confirm or observe that indeed the ANC attendance in Oromo local government is increasing? So look at them now. These are the indicators. The number of ANC sessions conducted. Mind you, if there are many ANC sessions, the pregnant women know that they will not spend too much time in the clinic. They will come because there are 5 physicians or gynecologists or health officer seeing the pregnant women. So they will come in their numbers. They will come in their numbers, and then you see them increase. Now, you also see the type. This is process. The data source. How do you get the information from the ANC register? The frequency, it is monthly. Responsible officer, it is the facility, officer that will be in charge of handling this, and so on, and the use of the data. Now, another one is the percentage of women attending NC at least once. We want to know, does anybody come beyond once, or they just come once, we don't see them again? And then you see the other 1% of women completing 4 ANC visits. And so you see that these are indicators that are waiting, that are put in place to be able to observe, to be able to confirm, to be able to check, to confirm or improve, or to observe that indeed the ANC attendance in Oromo local government is increasing. And by the time we carry out our analysis, we can tell if it's from 60% to 80% within 12 months. So what are the components of the M&E plan document? Like I said in the past, it includes the indicators, the types, the data resources, the frequencies, the responsibility, the use of data, and that's what you have seen here: the type, indicator, type, data source, frequency, responsible officer, the use of the data. So you could be given this to fill or to provide, an M&E plan for ANC attendance program. So take note, that's why I've discussed this with you. So this is the indicator. You see the questions that we have to ask in order to spark the, thinking, to spark the interest in it. So when you see percentage of women completing 4 ANC visits, that's the outcome. Where do we get information from? That's ANC, that's the ANC register. That's how you get the data source. Now, what is the frequency? That's quarterly, because it's a pregnant woman, and you want to be sure that from time to time they visit and you do a follow-up, you write your report quarterly to the state, and so on. So maternal mortality ratio too is an indicator. The type is an impact type. Data resources from the facility summary reports. What's the frequency of the maternal mortality ratio in reporting? You do that annually. And so this is just an example of an M&E component. And so that's that we have seen there. So next, we want to look at the case scenarios. What are the case scenarios? So the case scenario will begin with the first one. A maternal health program in Enugu aims to reduce postpartum hemorrhage after 6 months. You now have incomplete registers, inconsistent entries, missing monthly reports. After 6 months, this is what we have observed. Yet when they started, the intention was that this health program in Enugu wants to reduce postpartum hemorrhage. And after 6 months, we saw that their registers were not complete. They had inconsistent entries, and they missed many monthly reports. So what part of these components actually failed? These components here, indicators, types, data sources, frequency, and so on. So what part of the indicators or component failed? Now, the data collection tools, the record keeping, that failed. Reporting mechanisms, that failed. Performance tracking, that also failed. Supportive supervision, well, that failed too, because if somebody was supervising them effectively, the registers would have been complete, the entries would have been consistent, and then they wouldn't have been missing monthly reports. Now let us look at the data tools that need to be improved. They need to improve their ANC register. They need to deliver, they need to also improve on their delivery registers. Those who come for ANC, their registers should be improved. Those who come for delivery, their registers should be improved. And then the facility summary sheets should also be intact. So we see that the facility summary sheet that is being used, they also need to develop it and improve it. And also they should ensure that their weekly report remains constant and not joke with it. So how performance tracking could help? Because in doing all these things, you need to track them. You need to check their performance. And in doing that, it will help to be able to do early identification of missing data. So when you check yesterday's report, if there are missing data, you can spot it immediately before a new one is written. And it will also help in continuous feedback loops. Discussions can continue off and on the field to ensure that our work goes on as planned. It could also help in targeted supervision. It could also help in timely corrective action. In timely corrective action. With that, we look at another lesson from the case scenario that we have learned. We have seen that the ANC and delivery registers need to be improved on, the facility summary sheets and so on need to be improved on. And we have seen that how you can perform the tracking, the basic benefit of performance tracking. We have seen that, I've talked about that, as you can see here. We'll now move to the discussion, and I'd like you to take note of these discussions because it's very important. Why are indicators important in monitoring public health programs? Why? That's question one. Now, indicators are important because they provide measurable evidence of whether a health program is progressing towards its objectives. From the lecture notes that we've discussed, I mentioned indicators and how they help the program managers. Number one, they help the program managers to determine whether the activities are being implemented as planned. They help the program managers to assess whether the program is on track or lagging behind. They also help the managers to measure the output, the outcomes, and the long-term impact. They also help the managers to be able to identify the gaps that require corrective action. They also support data-driven decision-making rather than making guessworks. Therefore, without those indicators, monitoring cannot objectively assess performance or guide improvements. So these indicators are key. They help you be able to know what is working, what is not working, and with this data, you can assess performance and be able to guide improvement, because without indicators, none of this would be possible. Question number two, consequences of poor reporting mechanisms at facility levels. What are the consequences of poor reporting mechanism at facility levels? Well, poor reporting mechanisms at facility level will lead to several program failures. You will have delayed transmission of data. This will prevent timely decision making. You also have incomplete and inaccurate data, which will weaken monitoring because you don't have the right information. You also see poor performance tracking, which will make it difficult to identify underperforming areas because there is poor performance tracking, so we don't know which areas are lacking behind. There's also the missed early warning signs, such as declining service coverage or stockouts. When you should have received those signs, you miss them. We also see weak accountability, as data cannot justify use of resources, because when you speak or you try to break down weak accountability, you will find out that your reporting, take note of what I'm about to say now, your reporting will help to ensure that all that needs to be seen, observed, checked are clearly brought to bear. So when your reporting is poor, we will miss those informations in the monthly reports. The feedback will not come when it ought to come. And the corrective measures will be ineffective because the corrective measures is not taking into cognizance all the informations that were required to be able to take the right decision in the first place. So those are the consequences of poor reporting mechanism at facility level. Now, number 3 question says compare indicator types using Nigeria examples. Compare indicator types using Nigeria examples. Now, we want to compare input, process, output, outcome, and impact indicators. Now, what is the input indicators? That is, this one's measure resources committed to a program. An example is that of the lasting mosquito net procured or number of health workers trained. So when you look at the number of nets purchased, the number of workers trained, that has to do with the resources committed into the program. For process indicator, it measures activity that is carried out using the inputs. Remember, we are dealing with number 3 question now. So it measures the activities carried out using inputs. So when we see activity carried out, we are talking about the number of antenatal clinics conducted or the number of outreach vaccination sessions that were held. These are activities that were carried out using the input from the input indicator. Now, when you look at the output indicators, they measure immediate results of program activities, such like the percentage of pregnant women who received, the treatment plan, or the number of children that were vaccinated during a session. Now, the output indicator leads to the outcome indicators. This reflects a short to medium-term health improvements. An example is the increase in ANC attendance rate or reduction in missed immunization opportunities. That leads to the impact indicators. This time is no longer a short to the medium term, but it measures long-term population level change. An example is the long-term reduction in maternal mortality ratio or the decrease in malaria incidence. And when you look at all these indicators together, these indicator types, I would say they provide a complete picture of program performance. So to answer that question, compare indicator types, you have to explain all the indicators. You have to explain the input indicators, process indicators, output indicators, outcome indicators, and the impact indicators. So that's number 4. Challenges. State the challenges affecting monitoring in low resource settings. So what challenges affect monitoring systems in low resource settings? Monitoring systems in low resource settings are affected by number 1, incomplete registers and poor record keeping. Number 2, it is affected by late or missed reports or missing reports that happens at the facility level. Number 3, we see weak supportive supervision. We're talking about the challenges that affect monitoring systems in low resource settings. We also see poor logistics and stockouts. These have disrupted service delivery and data collection. We also see limited human and financial resources. We have also seen inadequate data quality assurance mechanism. The inadequate data quality assurance mechanism. The lecture notes that we talked about emphasize that even strong interventions will fail when monitoring systems are weak. So you need to put all these monitoring systems intact. Once you do that, the one regarding the registers, missing reports, supportive supervision, logistic and stockout, the human and financial resources, data quality assurance, once you put all those things intact, definitely you will see that in the low resource settings, all these challenges will be dealt with. And finally, how have the district's health information system to improve health data quality in Nigeria? It has improved health data quality in Nigeria by providing standardized digital form which is needed for routine reporting according to the lecture notes that I taught you in some slide notes back. So everybody has it. Once you are sent on the feed, you put it on your phone, you put it on your laptop, you download the app, and from there you send your information, just like using the Kobo tool for data collection. We also see that it has improved health data quality in Nigeria by providing, consistent and standardized data entry, timeliness of monthly reporting, because it has enabled all these things. So imagine where consistent data, standardized data entry is enabled in those facilities. When you have improved timeliness of monthly reporting, you no longer delay the monthly reporting because of this improved health data quality using these instruments, DHIS. You also have the fact that it supports data validation and review. Your data is looked at, is validated, is reviewed. We also see that it strengthens evidence-based decision making, because when this data are available, you can make your decision boldly. You can make your decisions more committed because you are sure of the information upon which your decision was based on. So by centralizing health data, the DHIS has strengthened monitoring, performance tracking, and accountability in Nigerian health programs. So let's see the summary here. Monitoring is continuous. Indicators guide the measurement. Data tools ensure structured collection. Reporting must be timely and accurate. Performance tracking drives improvements. And M&E plans organize monitoring activities. So you see the role that they play. You see the role of the indicators. You see the role of the data tools. You see the importance of the reporting. You see the importance of performance tracking devices, options. And we have seen what M&E plans, do. Because the M&E plans organize monitoring activities. You put them down on paper, you design them, and then you carry out the monitoring activities. Let's see the assessment questions, just a few of them. Which indicator types measure short-term program results? Of course, that is output. Short-term program results, output. The DHIS is mainly used for what? Of course, health data reporting. We've said that again and again. Which of the following is not a standard feature of monitoring? It is the budget appropriation. That's not a standard feature of monitoring, but comparing results to the target, continuous data collection, taking corrective action, that is a standardized feature of monitoring. But budget appropriation, no. So that's just a few of assessment questions. So you need to read in between lines so that you can get the details. So now this is your assignment. This is your assignment. I repeat, this is your assignment. You are to write the answer below the video in the comment section. Do not put your name. You are to just simply put your mark number. At the end of this class, which I'll be stipulating, then I will take the data, the information from each of the answers. I mean, just extracting the mark number, having it through. But if you do not get it upon reading it, then I will have to inform you that your performance wasn't too okay. So take time to understand it. I've made a lot of examples. I've made a lot of explanation. And when I say types of indicator used in monitoring, you know that. The key data collection tools in PHCs, you know that. Performance tracking and relevance, you understand that by now. So give me the short answers on the comment section and put your mark number only. So these are the references. You can get any of these books. They're important. The Media Day-1 at Jumon, 2019 Introduction to Public Health in Nigeria is very important. The Oxford textbook of Global Public Health is also very important. You can get these ones, then have them for your personal consumption. You can read more and wide. So once again, thank you. We have just discussed under health program planning and evaluation. We have discussed monitoring of health programs. We have seen the indicators, data collection tools, performance tracking. We have seen the reporting mechanisms. We have seen designing a simple monitoring and evaluation M&E plan. My name is Dr. Area Saboni. Thank you for listening. I'll see you in the part 4 of this same course. Bye. And make sure you carry out your assignment. I'll be checking them on the particular date assigned. Take care.